Are you concerned about the health of your aging parents? Use this guide to assess your aging parents and what you should do if they need help. As your parents get older, how can you ensure that they have the ability to take care of themselves and maintain their health? When you visit your parents, keep the following questions in mind. Can your parents take care of themselves? Pay attention to how your parents look. Failure to maintain daily routine habits, such as bathing and brushing teeth, may indicate a state of dementia, depression, or physical weakness. Also, pay attention to your parents' home. Does the lighting work? Does the heating work? Are backyard plants in good shape? Any changes in the way your parents do household tasks may provide clues about their health. For example, a burnt pot may mean that your parents don't remember the food being cooked on the stove. Neglecting household chores may be a sign of depression, dementia, or other problems. Do your parents suffer from memory loss? Everyone forgets things once in a while. Mild memory problems are a fairly common symptom of aging. And drug side effects or underlying conditions contribute to memory loss. However, there is a difference between normal changes in memory and memory loss associated with Alzheimer's disease and other types of dementia. Are changes in your parents' memory limited to misplacing glasses or sometimes not remembering a date? Or are the changes a cause for concern, such as not remembering common words when speaking, not knowing the way around in familiar neighborhoods, or being unable to follow directions? Are your parents safe in their home? Check your parents' house to watch for any signs of danger. Are your parents struggling to navigate narrow stairs? Has one of your parents recently fallen? Can they read the directions on medication packages when you ask? Do your parents tell you how safe they feel at home? Do your parents feel safe on the road? Driving can be difficult for older people. And if your parents become confused while driving, or if you are concerned about their ability to drive safely, it may be time to stop driving. Have your parents lost some weight recently? Losing weight without trying to lose it could be a sign of a problem. Weight loss can be related to many factors, including the following. Difficulty cooking. Your parents may have difficulty obtaining the energy to cook, hold utensils for cooking, or read labels or directions on food products. Loss of the sense of smell or taste. Your parents may not be interested in eating if the food no longer tastes or smells as good as you are used to. Underlying disease states. Sometimes weight loss indicates a serious underlying condition, such as malnutrition, dementia, depression, or cancer. Do your parents have good spirits? Notice your parents' mood and ask how they are feeling. Drastically different moods could be a sign of depression or other health concerns. Are your parents still engaging in social life? Also talk to your parents about their activities. Are they still in a relationship with friends? Do they maintain an interest in hobbies and other daily activities? Are they involved in associations or clubs? If your parents stop being with other people, it could be a sign of something wrong. Can your parents move around? Pay attention to the way your parents go. Do they seem hesitant or unable to travel their usual distances? Have they recently fallen? Does arthritis in the hip or knee make it difficult to move around the home? Would it be good for your parent to use a cane or walker? Also, problems such as muscle weakness and joint pain may make it difficult to move. If your parents have an imbalance when standing up, they may be at risk of falling, one of the main causes of disability in the elderly. Take a stand. There are many steps you can take to make sure your parents are healthy, even if you don't live nearby. For example, share your concerns about them. Talk to your parents. Your fears may motivate your parents to see the doctor or make other changes. Consider engaging other people who care about your parents, such as other close people, close friends, or a clergy member. Encourage them to have regular medical checkups. If you are concerned about your parents' weight loss, depressed mood, memory loss, or any other symptoms and signs, encourage your parents to make an appointment to see a doctor. You could offer to schedule the visit, take them to the doctor, or even find someone else to attend the visit with. Also ask about follow-up visits. Discuss safety issues. Point out any potential safety issues your parents may have, and then create a plan to discuss the issues. For example, your parents might benefit from using assistive devices to access items on high shelves. Using a raised toilet seat or a firm handrail in the toilet may help avoid falls. If your parents can no longer drive safely, suggest other transportation options, such as taking the bus, using a truck, or hiring a driver. Consider home care services. If one of your parents is finding it difficult to take care of themselves, you can hire someone to clean the house and do small tasks. A home health care provider may help your parents with daily activities such as bathing. You may also consider using Meals on Wheels or other community services. If staying home is difficult for them, you may suggest moving to a living assistance facility. Contact a doctor to request advice. If your parents ignore your concerns, consider calling the doctor directly. Your thoughts and vision may help the doctor understand what to consider during upcoming visits. Keep in mind that the doctor may need to check that they have permission to speak with you about your parents' care, which may include a signed form or waiver document from your parents. Ask for help from local authorities. Local agencies specializing in aging matters, which you can find using the U.S. Home Locator Service. A public service provided by the Department of Aging can help connect you with these services in your parents' area. For example, your parents' county may have social workers who can assess your parents' needs and connect them with services such as home care professionals. Sometimes parents don't acknowledge that they need help, and others don't realize that they need help. This is where your turn comes in. Make sure your parents are aware of the problem and the solution you're suggesting. Remind your parents that you care about them and that you want to enhance their health and well-being, both now and in the years to come. Alright, that's gonna do it for the older parents, 8 warning signs of health problems. If you enjoyed the video or learned anything, leave a like and subscribe if you haven't. Thank you for watching. Goodbye.